transitions from fetal life into neonatal life. Okay, what we'll do is let's draw first. So there are several components here. There are several components of how a fetus adapts into the extrauterine life, into a neonatal life. And the single most important element are the cardiorespiratory punya adaptation. So that's the most important adaptation. Because if you understand the how a baby adapts from being a fetus into becoming a newborn, then you'll understand most of the major problems. Okay, few questions. The first one, does a baby breathe? Baby a fetus, does a fetus breathe? You rasa dia breathe ke tak breathe? Huh? Anyone? Fatin, I saw you trying to answer. Fatin Hanani.
I think yes.
Yes, that's true. That's true. So a fetus does breathe. If you remember when you did your ONG kan ada the biophysical profile scans, kan the detail scans. So one of the element that they look at is breathing. So a term fetus usually breathes at around 12 breaths per minute. 12 breaths per minute. Macam mana dia breathe? Basically you can nampak dia punya contraction of the diaphragm, contraction of the diaphragm, the chest, the increase in the chest, there'll be chest movement and so on and so forth. But does the fetal breathing though have any effect tak? Tak ada lah sebab the main organ for respiration in us as adults or in children, the main organ, what is the main organ of respiration? Our lungs lah kan. The lungs are the main organ of respiration. But in the fetus, the main organ of respiration is basically the placenta. So placenta is the main organ of respiration. The gaseous exchange, when you release the carbon dioxide and you get the oxygen, that occurs in the placenta. So placenta is the main organ of respiration. In utero, lungs basically do not have that much function. Okay. The first thing, okay, let me draw. If you imagine this is your, let me change the color first. Okay. If you imagine, can you see my pen ni tak? Nampak pen ni tak?
Yes.
Okay, if you can imagine this is your lungs, Okay, in your lungs ni, dia ada banyak from the trachea, dari trachea pergi your main bronchus kan. The main bronchus go into smaller your smaller bronchus and then to the bronchioles. And then if you look at the very end there, there's your alveolar kan. The alveolar, this is the alveolar. The thing is, in utero, everything is filled with fluid, which is the amniotic fluid. Kan? Everything sampai inside the airway semua ni, all are filled with fluids. All are filled with fluids. And this fluid ni, the amniotic fluid ni is very, very important. For example, in a child that has oligohydramnios, a child that have oligohydramnios, not enough amniotic fluid. Kan? Oligohydramnios kan? In a fetus that has oligohydramnios, maternal scan nampak, oligohydramnios, AFI dia is very low. Oligohydramnios is associated with pulmonary hypoplasia. Pulmonary hypoplasia, when you don't have enough fluids inside your lungs, the lungs will not develop. There was one study which I was one of the co-author. The study in UK we did. So in a child, in a fetus with congenital diaphragmatic hernia, So one of the problem with congenital diaphragmatic hernia is the bowel content goes inside the chest, compresses on the lungs, and the main problem is actually pulmonary hypoplasia, where the lungs does not form. So what we did was, there's a feto study, feto. So feto study ni, what we do is, in utero, at around 8 to 12 week period of gestation. 8 to 12 week period of gestation. Masa tu baby ni weighing probably 100 gram, less than 100 gram kot. So we in utero, through the mom's tummy tu, kita masukkan satu tube masuk dalam baby punya airway, and we put a balloon here. Kita letak balloon dekat dia punya trachea dia. Kita letak balloon dekat trachea fetus tu at around 8 to 12 week period of gestation. Kita letak balloon dekat sini. Bila kita letak balloon dekat sini, what it does is it increases the pressure dekat dalam airway dia. Bila dia increase pressure, fluid daripada dalam ni tak boleh nak keluar, so it increases pressure. Dalam lung pun kita still produce fluid kan, so increases pressure. So it, studies have shown it actually helps reduce the rate of pulmonary hypoplasia. So we need my point is, number one, fetus in utero breathe, cuma breathing dia it is not for respiratory function. So because the main respiratory organ in fetus is actually the placenta. So bila baby tu born, dia kena transition from the placenta as the main respiratory organ to the lungs as the main respiratory organ. Nombor satu. Nombor dua, lungs need the amniotic fluid for the lungs to mature. Without adequate amniotic fluids, the lungs will not mature. And bila lungs are not mature, what happens is pulmonary hypoplasia. It doesn't form really well. Okay. Nombor tiga, if you look at here, ya, dalam dia punya airway dia ni, sekarang kan filled with fluids. Dalam ni semua ada air. Dalam ni semua ada air. And all this fluid has pressure. Dia outward pressure. That's the normal lah. Mana-mana fluid pun dia ada counter pressure outwards. If you look at your lungs punya vessel, dekat tepi-tepi lung ni, dia ada banyak blood vessel. Dia ada banyak blood vessel. These are all the pulmonary circulation. These are all the pulmonary circulation. So bila dalam lungs ni, bila dalam airway ni are filled with fluid, what happens is it compresses on the pulmonary vessels. Bila dia compress the pulmonary vessels, what it does? Apa jadi bila vessel dia ada benda compress on the vessel? It increases the pulmonary resistance. Increase the pulmonary resistance. So pulmonary resistance increases. Okay. Let's look at, if you look at BP, blood pressure. What's the formula for blood pressure? Formula for blood pressure? Year one, first week, you learn on this already. Probably one of the first few lectures in physiology. You should learn this already. BP equals to cardiac output.
Cardiac output times total peripheral resistance.
Total peripheral resistance. Cardiac output equals stroke volume
times heart rate.
Heart rate. Okay. Look at this. So this is systemic BP. This is systemic BP. Sebab tu systemic BP dia tengok pada peripheral resistance, total peripheral resistance. It's a net punya resistance. Dia bukan kira satu-satu. It's a net resistance. So total semua. Sebab kita punya circulation kita ada yang serial circulation, ada yang apa, so there's a different type of circulation kan. But it's a net resistance. Okay, nombor satu. So kalau kita tengok, this is systemic BP. Bila dia ada systemic BP. Wait, silap. Sorry. Okay, dia ada BP systemic, dia ada BP pulmonary. Okay. Pulmonary BP dengan systemic BP. So systemic BP depends on the cardiac output times total peripheral resistance. Kalau you look at pulmonary BP, it will be total pulmonary resistance lah, kan? Pulmonary BP is cardiac output times total pulmonary resistance. Okay. Your lungs, this is your lungs. This is a very bad drawing, but it does. This is your heart. Heart is basically in the middle here lah. Heart is basically in the middle there. Is there. Heart is there, but this is your heart. Can your heart? There's 4 chambers. Can this is your right atrium, right ventricle, left atrium, left ventricle. So blood from the, if you imagine this is your body, can everything is there. Can so blood from the body goes into the right atrium. Daripada right atrium goes into the right ventricle. Daripada right ventricle it goes into the lungs. It goes into the lung through the PA. This is your SVC and IVC. Whatever goes into the heart is your vein. Whatever goes into the heart is vein. Whatever goes away from the heart is artery. Into the heart, vein. Away from the heart is artery. So vein, vena cava, superior vena cava, inferior vena cava goes into right atrium, goes into right ventricle. The right ventricle goes into the lungs through the pulmonary artery. Daripada pulmonary artery ada 4 vessel, ada 4 vessel, which is your pulmonary vein, kan? Ada 4 pulmonary vein goes into the left atrium. Left atrium goes into the left ventricle. Daripada left ventricle it goes into your body through your AO, aorta, which is the major artery, kan? So this is the normal circulation. Sekarang, if you can imagine here, this is your placenta. This is a very bad drawing of a placenta. It doesn't really matter. I used to draw it better, but I don't care. So through your placenta, dia ada 2 vessel, kan? Satu, this one large vessel. Allah. There's this one large vessel, which is the umbilical vein. Umbilical vein. Umbilical vein, maknanya they go towards the heart. Kan? So from the placenta into the vein. Masuk dalam IVC through your, dia ada satu connection dekat sini yang sambung di antara IV daripada umbilical vein masuk ke IVC. This is your, apa ni nama ni? Ductus venosus. Ductus venosus. So umbilical placenta masuk through umbilical vein, through the ductus venosus masuk ke IVC. IVC masuk ke right atrium. Lepas tu daripada sini daripada iliac artery, dia pusing kat heart ni sebab kan, iliac artery daripada sini ada 2 vessel keluar. These are your, dia pergi kat sini, dia 2 kat sini, dia 2 pusing, dia masuk kat sini. These are your umbilical artery. Umbilical artery daripada iliac arteries. Ada 2 kan, 2 umbilical artery masuk ke placenta. This is for the exchange. Okay. Few things. Number 1, placenta ni, your placenta ni is a highly vascular organ. Highly vascular organ. And the way placenta is made ni, kan, cara placenta is made ni, it is a very, very low resistant punya circulation. It's a very low resistant punya circulation. So, what it does is, bila ada placenta ni, it's a very low resistant circulation. Bila kita campur a very low resistant circulation dalam the total resistance ni, because the presence of placenta, it reduces the net pressure. Placenta reduces the total peripheral resistance. Placenta, presence of the very low resistance circulation in the placenta causes reduction in the net total peripheral resistance. So bila total peripheral resistance reduce, what happen is systemic BP goes down. Systemic BP goes down. So BP pulmonary naik. Sebab apa naik? Sebab fluid ni presses on the pulmonary circulation, increases the pulmonary resistance. If you look at foramen ovale, dia ada flap. What do I mean by ada flap? Dia macam tu. Lepas tu dia ada flap, dia macam ni. Dia macam tu. So bila dia ada flap, dia boleh fluid blood daripada sini boleh pergi ke sini. Tapi fluid daripada sini tak boleh pergi. Dia akan tutup. Dia ada flap. So this is what happens in foramen ovale. There's a flap. Dia tak ada defect. Bila ada defect, dia jadi atrial septal defect. So this is the difference between ASD and foramen ovale. Pattern foramen ovale. So bila blood daripada placenta masuk umbilical vein masuk through your ductus venosus, masuk to IVC, pergi ke right atrium. Daripada right atrium ni dia bypass everything, dia go into the left atrium. Daripada left atrium dia go into the left ventricle dan pergi masuk ke aorta. Okay, some blood daripada right atrium ni dia tak pergi ke foramen ovale, dia turun ke bawah, pergi ke right ventricle. Daripada right ventricle dia pergi ke pulmonary artery. Tapi bila dia masuk ke pulmonary artery, there's high pressure dekat sini. Bila high pressure, apa dia buat? Dia tak pergi sini lah, dia bypass lah. So dia bypass ikut mana? Dia bypass ikut sini. There's a duct that is connecting between the pulmonary artery to aorta. What duct is this? This is your ductus arteriosus. Ductus arteriosus. It connects between the two major arteries. Ductus arteriosus is a duct that connects between the two major arteries, which are the pulmonary artery and also the aorta. So because high pressure dekat lungs ni, pulmonary pressure very high, so blood tak pergi ke pulmonary naik atas. So dia bypass dekat level of pulmonary artery, goes into the aorta through your ductus arteriosus. So blood daripada left ventricle punya blood yang daripada right atrium tadi kan, left ventricle, dia campur dengan blood daripada ductus arteriosus, dia masuk dalam aorta, goes into the body, bla bla bla, sampai dekat iliac artery kan. Some of them will go into the umbilical artery and pergi dekat placenta for gaseous exchange. Some will go further into the body and then masuk ke ventricle, masuk ke IVC, pusing balik. So that's what happened. This is what happens in utero. Okay, clear so far? This is what happens in utero. Okay. Now, sorry. So now the baby is being born. Okay, so baby being born. Bila baby lahir, few things will happen. Bila baby keluar, what happens first? Okay, Bila baby nak keluar, sebelum baby keluar, what happen? Ada contraction kan? Ada contraction. What happens bila contraction? Bila ada banyak contraction, reduces the fetal circulation. Reduces the fetal circulation. Sebab tu bila ada uterine tetany kan, uterine hyperstimulation, uterine tetany is a risk factor for cerebral palsy. Sebab fetal circulation kurang, blood supply into the placenta reduces. Boleh jadi hypoxia. Sebab apa? Uterine tetany. Bila uterus tu banyak sangat contraction, reduces the placental supply. Reduces the placental blood supply. Ataupun kalau so basically contraction ni reduces the placental supply. Bila placental supply reduce, what happens? You reduce the PaO2. PaO2 dekat baby. Kan? Bila uterine supply, uterine circulation is reduced with the frequent contraction ni, reduces the PaO2 in the baby. PaO2 in the baby reduce sebab kurang supply of oxygen into the placenta. Nombor satu. Baby keluar, what happens? Baby takes the first breath. Sebab apa baby takes the first breath? Few reasons. Nombor satu, PaO2 dia reduce, kan? PaO2 reduce. Lepas tu baby keluar, kita removekan placenta ni daripada mother. Placenta remove daripada mother. So placenta tak dapat blood daripada mother, placenta pun reduce blood. So PaO2 baby ni lagi-lagi reduce. PaO2 baby reduce. Lepas tu kita cut pula, kita potong pula kat sini. Kita remove the baby from the placenta. What happens? PaO2 baby semua reduce. PaO2 reduce, PaCO2 baby akan naik. PaO2 reduce, PaCO2 increase. So what happens? Bila PaO2 reduce, CO2 naik, what happens to the body? Kita ada dua sensor dekat our body kan, which is the carotid body and aortic body. And if you remember, this should be in your first lecture, physiology. Kan, PaO2 increase, PaCO2 reduce, your carotid body, your sensor dekat carotid body and aortic body sends the signal to your cardiorespiratory center. Dekat mana cardiorespiratory center tu? Where is it?
Brainstem.
Okay. Specifically kat mana?
Medulla oblongata.
Pons. It's at your pons. So the cardiorespiratory center is in your pons. So cardiorespiratory center akan fire. Dia akan hantar signal. Oh, we are now facing a problem where we have low PaO2 and high PaCO2. So we need to start to breathe. So dia akan hantar signal. Oh, we need to breathe. So baby will take the first breath. Kan? Bila baby takes the first breath, what happens? Dia induces negative pressure intrathoracic. Intrathoracic pressure reduces. Sebab apa? Sebab diaphragm kan, ni diaphragm at rest. Bila diaphragm contract, dia straight. Dia increase dia cause negative pressure intrathoracic. Sebab bila dia contract, dia straight. Bila dia relax, dia bengkok macam ni. Kan? So bila diaphragm contract, it increases intrathoracic pressure. Dia reduces intrathoracic pressure. It stuck air inside. So bila negative pressure, what happens? Dua benda happen. Yang pertama, air daripada luar, kan, sebab baby dah keluar kan, at least kepala dah keluar. So baby keluar, air daripada dalam, daripada luar, daripada environment masuk ke dalam airway. Fluid ni nak pergi mana? Fluid ni dua benda yang happen. Yang pertamanya, masa baby nak keluar, macam mana cara baby keluar? Baby keluar spontaneous vaginal delivery. There's a mechanical compression of the chest. Mechanical compression of the chest. Masa born by vaginal delivery. So bila mechanical compression ni, it pushes fluid ni out of the baby. Sebab mechanical compression. Sebab itu in babies yang born by cesarean section, there's no mechanical compression of the chest. Bila tak ada mechanical compression of the chest, fluid ni akan banyak still tinggal dekat dalam airway dia. Sebab itu dia boleh dapat transient tachypnea of newborn, which is common in babies born by cesarean section. Sebab apa? Sebab there's no mechanical compression of the chest. Faham tak? Okay, so fluid ni keluar by few mechanism. Yang pertama, mechanical compression of the chest by being born by spontaneous vaginal delivery. Nombor satu. Nombor dua, bila baby takes the first breath, air daripada luar masuk ke dalam. And negative pressure dekat intrathoracic ni. So bila negative pressure, by osmosis, fluid daripada dalam airway ni akan keluar. Akan keluar pergi ke interstitium. Fluid daripada dalam ni akan keluar. Bila fluid keluar, dia akan masuk, bila dia masuk dalam interstitium dan dia akan dikeluarkan daripada body through the lymphatics. Through the lymphatic drainage. So, two mechanism. Fluid dalam lungs ni, dua mechanism. Yang pertama, mechanical compression of the chest when the baby is being born vaginally. Nombor dua, bila negative pressure dekat dalam negative intrathoracic pressure, air akan masuk into the airway through the mouth, through the nose, masuk dalam lung, masuk dalam airway, and because negative pressure juga dia akan water inside, fluid inside the lung ni akan masuk into the interstitium and drain through the lymphatics. So first breath sikit, second breath lagi banyak, third breath clear langsung air. And all the fluid should clear out the lungs within the first 4 hours. Within the first 4 hours, semua fluid ni akan clear out from the lungs. Kalau fluid ni tak berjaya clear out, this is what we call as transient tachypnea of newborn. Okay, clear? Sekarang, what happens? Bila kita potong placenta daripada systemic circulation, remember I told you the presence of placenta, which is a very highly vascular organ and with very low resistance, it reduces the net total peripheral resistance. Sekarang kita buang placenta ni, kita cut off placenta. Bila kita cut off placenta, net total peripheral resistance increase. Bila net total peripheral resistance increase, systemic BP goes up. Nombor satu. Nombor dua, fluid daripada dalam lungs, daripada airway ni semua dah keluar. Bila semua dah keluar, there's no more compression on the pulmonary vessels. Bila tak ada compression on the pulmonary vessels, it reduces the pulmonary resistance. Because tak ada dah fluid yang compress on the vessel tu. Nombor satu. Nombor dua, sebelum ni, dalam airway ni is filled with fluid. Sekarang dalam airway ni is filled with air. And air has 21% FiO2, which is higher FiO2 as compared to in fluid. So increase in the FiO2, increase in oxygen. Bila increase in oxygen, what we know is, especially for the lungs, especially for the pulmonary blood vessels, oxygen is a very good vasodilator. Oxygen is a very potent vasodilator. So bila kita increasekan oxygen concentration, what happens is there will be pulmonary vasodilatation. Bila pulmonary vasodilatation happens, it reduces the pulmonary resistance further. So pulmonary BP goes down a lot. Why? Because tak ada compression dah and pulmonary vasodilatation. So pulmonary BP goes down. Systemic BP goes up. So sekarang apa jadi? So blood dah tak ada placenta kan? So blood daripada body, tak ada dah blood supply through the ductus venosus. Blood daripada body terus masuk ke right atrium. Daripada right atrium, Sebab sekarang ni right side pressure dah reduce. So dia tak bypass dah. Dia tak pergi dah ke through the foramen ovale ni, dia terus turun ke bawah. Bila turun pergi ke right ventricle, dia pergi ke pulmonary artery, pressure dah lower dah ni. So aorta pressure increase, pulmonary pressure goes down. Bila systemic BP goes up, pulmonary BP goes down, so dia tak bypass the ductus arteriosus anymore. They go through from the right ventricle through the pulmonary artery straight into the lungs. Sebab pulmonary pressure dia dah reduce, systemic BP goes up, so dia tak go through dah, dia tak bypass the ductus arteriosus anymore. Daripada lungs, they go to the pulmonary vein, masuk left atrium. So sekarang ni left atrial pressure is higher daripada right atrial pressure. Kan? Bila pressure sini lagi high, dia boleh bypass sini tak? Tak boleh sebab foramen ovale is a flap. So foramen ovale prevents blood from going from the left to right. So blood daripada left atrium now goes into the left ventricle and goes to the aorta. Kenapa dia tak bypass sini? Sebab bila dia bypass ni kan, dia masuk aorta. Sekarang aorta pressure is higher daripada pulmonary artery. Boleh tak dia bypass sini? Through the ductus arteriosus, dia patah balik ke sini? Definitely boleh. Tapi what happens is, two mechanism happen. Yang pertama, oxygen. High oxygen, so the way ductus arteriosus acts ni, dia opposite dengan pulmonary circulation. In the sense, bila you increase the oxygen concentration, you increase the PaO2, it causes the ductus arteriosus to spasm, to close. Increased oxygen causes the ductus arteriosus to close. Number dua, bila all this thing happen, it reduces the prostaglandin. PGE reduces. Prostaglandin E especially reduces. Reduction in prostaglandin causes the ductus arteriosus to close, to shut. Okay, faham? So ductus arteriosus will begin to close. And the process of closing the ductus arteriosus ni, sometimes it takes up to 5 days. Up to 5 days. Sebab itu, if you see the ductal dependent cyanotic heart disease. Ductal dependent cyanotic heart disease. Apa contoh ductal dependent cyanotic heart disease? Ductal dependent cyanotic heart disease ni are cyanotic heart diseases that depends on the duct. Without the ductal arteriosus, dia tak boleh. It's not compatible with life. Contohnya macam TGA. Contohnya macam apa lagi? Apa lagi contoh? Ada banyak contoh. So, ductal dependent cyanotic heart disease ni, most of the times kita akan nampak dia at around day 5 of life. Sebab the closure of the ductal arteriosus usually takes around 5 days. Okay, so bila pressure kat sini, left atrium tinggi daripada right atrium, it closes the foramen ovale. It closes the foramen ovale. Usually it takes around 2 weeks juga untuk foramen ovale to properly close. Okay, faham? So now we are into the normal neonatal circulation, normal newborn circulation. Okay, clear tak so far? So in utero, these are the changes, the placenta, function of the placenta, ductus venosus. Lepas tu at birth, kan? Again, few mechanism will happen. Reduce in PaO2, increase in PaCO2, causes the baby to breathe. Bila baby breathe, fluids akan keluar. Fluids keluar juga by the mechanical compression. Okay, clear so far? Clear? Okay, now let's go to the slides.